The adrenal glands are also known as your suprarenal glands. They are small glands found on top of each kidney. The inner part of the gland is called your adrenal medulla. It produces three catecholamine hormones, your norepinephrine, your epinephrine, and your dopamine. And the outermost part is called the adrenal cortex. It produces steroid hormones that are essential for life. If there is complete loss of these hormones, it can lead to death due to dehydration and electrolyte imbalances. The adrenal cortex makes up the bulk of the adrenal gland. Its cells are organized into three densely packed layers of epithelial cells, forming an inner, a middle, and an outer region of the cortex. So the outer layer of the adrenal cortex is called your zona glomerulosa. It secretes hormones called your mineralocorticoids, in which the most important hormone is called your aldosterone, which is responsible for the mineral homeostasis. The middle layer is called your zona fasciculata, or your zona fasciculate. So it secretes mainly your glucocorticoids or your glucose for glucose homeostasis. The innermost layer is called your zona reticularis. So it secretes androgen. These are your steroid hormones responsible for the masculinizing effects. So first would be your mineralocorticoid hormones. So it regulates the concentration of the mineral electrolytes. So the most important hormone would be the aldosterone. It regulates sodium reabsorption and potassium excretion by the kidneys. It plays a part in your renin-angiotensin-aldosterone system, or your RAAS. In order to regulate the blood pressure, so your liver would produce a hormone called your angiotensinogen. Your kidneys will also produce an enzyme called your renin. So the reaction between your renin and your angiotensinogen would produce your AG1 or your angiotensin 1. This will be released in your bloodstream until it will reach your lungs. Your lungs contains your ACE, or your angiotensin converting enzyme. Your ACE will convert your A1 into A2, or your angiotensin 2. Your angiotensin 2 has a direct effect to your blood vessels. It will cause vasoconstriction. Again, vasoconstriction means it will narrow the diameter or decrease the diameter of the blood vessels, causing it to increase the resistance and increase the blood pressure. Your angiotensin 2 will stimulate your adrenal glands, specifically your zona glomerulosa, in which it will produce or secrete your hormone aldosterone. This hormone will increase the sodium reabsorption, in which, if there is salt, water follows. So there will be increased blood volume. Increased blood volume would lead to increase in blood pressure. Consequently, during this process, potassium is also lost during the excretion process by the kidneys. The middle layer of the adrenal cortex secretes cortisol, also known as your hydrocortisone, which is a glucocorticoid hormone. Cortisol stimulates the liver to synthesize glucose from circulating amino acids. It causes adipose tissue to break down fat into fatty acids and causes the breakdown of protein into amino acids. These molecules are released into circulating blood to be taken up by tissues as a quick source of energy. The action of the cortisol helps the body during stressful situations and helps maintain the proper glucose concentration in the blood between meals. Cortisol also helps reduce the inflammatory response. As discussed earlier, stress can trigger the release of your cortisol. Your cortisol can lead to hyperglycemia due to the increased synthesis of your new glucose molecules. This can also increase your blood pressure and suppress the immune system. This will lead to increased risk of new infections, but this will reduce the inflammatory response. Therefore, it will decrease the pain, the swelling, the heat on that area. Cells in the inner zone of the adrenal cortex produce the adrenal sex hormones called your androgens. These are your male sex hormones. Small amounts of androgens are secreted by the adrenal cortex in both men and women. In adult men, most androgens are secreted by the testes. This hormone stimulates the development of male sexual characteristics such as a deep voice and hair growth in the pubic area, chest, axilla, and your linea alba. In adult females, the adrenal androgens stimulate the libido or the female sex drive. High levels of adrenal sex hormones can manifest masculinizing changes in women such as facial hair growth and lowering of voice pitch. In cases that the patient would administer drugs or medications like your androgenic steroids, this will cause increased hair growth in the face or in the other areas known as your hypertrichosis, or also known as your werewolf syndrome. If the adrenal cortex fails to produce enough hormones, a condition known as Addison's disease develops. So other symptoms include decreased blood sodium, leading to dehydration and low blood pressure. Since there is decreased aldosterone levels, this will decrease the sodium reabsorption. Also, there will be low blood glucose, causing fatigue and listlessness. Since there is decreased cortisol levels, there will be decreased glucose molecules in the body. So, without treatment, it can lead to death due to severe changes in the electrolyte balances in the blood. Too much secretion from the adrenal cortex can lead to a condition known as the Cushing's syndrome. There would be high glucose concentration and lowering tissue protein. So again, there would be increased cortisol levels, leading to increased glucose molecules in the blood. There would be retention of sodium that causes tissue fluid increase, resulting in puffy skin. The patient will also exhibit obesity, a moon-shaped face, skin atrophy, and menstrual problems in women. This can also lead to masculinizing changes in women, such as facial hair growth and lowering of voice pitch. Since there is sodium retention, because there will be increased levels of aldosterone. So this is an illustration between the symptoms of Addison's disease and your Cushing's syndrome. Your Addison's disease, the patient manifests anorexia, nausea, vomiting. There would be hyperpigmentation or bronzing of the skin. The patient will also manifest diarrhea, abdominal pain, as well as muscle weakness. Whereas in patients with Cushing's syndrome, there would be thinning of the hair. There would be moon phase, increased facial hair. There would be a presence of a buffalo hump. Next there would be truncal obesity and striae of the skin. Here, the patient also manifests muscle wasting that will lead to weakness and thin extremities. Since there is increased glucose levels in the blood, so patients with Cushing's syndromes are prone to develop diabetes. Next would be your adrenal medulla. The adrenal medulla produces large amounts of hormone adrenaline, also known as the epinephrine, and small amounts of norepinephrine or your noradrenaline. These hormones are released in response to signals from the chromaffin cells of the sympathetic division of the autonomic nervous system. The epinephrine and norepinephrine are commonly referred as the fight or flight hormones because they get the body prepared for stressful situations that require vigorous physical activity. When a person senses danger and experiences stress, the hypothalamus of the brain triggers the adrenal gland via the sympathetic division of the autonomic nervous system to secrete its hormone. As a response, this will increase the cardiac output, blood pressure, and blood flow towards the heart and other organs or tissues via the systemic circulation. This will dilate the airways to the lungs as well as increase blood levels of glucose and fatty acids. These hormones cause the breakdown of glycogen into glucose in the liver and release of fatty acids from stored fat cells. The glucose and the fatty acids are released into the bloodstream as a quick response for the synthesis of your ATP, or your adenosine triphosphate. The heartbeat or the heart rate and blood pressure increases to get the glucose and fatty acids to the muscle cell. Blood flow decreases to internal organs and skin but increases to muscle cells. The lungs take in more oxygen to get rid of more carbon dioxide. These changes all prepare our body to either fight or flee the stressful situation. Here is the summary of the adrenal gland hormones. So first would be hormones of the adrenal cortex. First would be your mineralocorticoids, mainly your aldosterone. It is important to increase the sodium and water levels in the blood. Next would be your glucocorticoids, mainly your cortisol. So it is important for stimulating your gluconeogenesis, or the production of new glucose molecules. It is important for protein breakdown, as well as it suppresses the immune responses. Next, you have the androgens. Okay, so it assists in maintaining the male secondary sex characteristics, such as having a deep voice and hair growth in the body. In females, it contributes to the female sex drive. Here you have the adrenal medulla hormones, such as your epinephrine and your norepinephrine. These are important to enhance the effects of the sympathetic nervous system responses during stress, such as increased cardiac activities. There will be bronchodilation, there will be decreased GI activity, decreased urine output, and many more.